This is the room. Okay.
Alright, so I'm gonna knock and then wash my hands. My name's Mariola. I'm gonna be your nurse today. I'm here to do a physical exam on you. Is that okay? Alright, and can you give me your name and your date of birth? And I'll check the ID tag. I'm gonna ask you a few questions. What month is it? And where are you right now? And why are you in the hospital? Okay, so my patient is alert and oriented ×4. So I'm going to start off by looking at your eyes. I'm going to look at them bilaterally. I'm going to start off by looking into the first pupil. And now I'm going to look at the pupil, but compare it to the other pupil. I'm going to do the same thing on this side. I'm going to look at this pupil and then compare it to the left pupil. All right, and then can you follow my pen light for me? Right, my patient's pupils are equal, round, and reactive to light and accommodation. And now I'm going to check your ear canal. I'm looking for any skin breakdown or any discharge. I'm gonna look at this ear as well. Everything looks good. And then I'm gonna press on your tragus. Let me know if you have any pain. All right, and then I'm gonna take a look inside your mouth. I'm looking at your oral mucosa, your throat, uvula, and your teeth. And the oral mucosa is pink and moist. Patient isn't missing any teeth and there's no visible signs of breakdown. And I'm going to ask you a few questions. Do you have any issues with vision, ear aches, mouth pain, or swallowing? No? Okay. So now I'm going to move down. I'm going to listen to your heart sounds. I'm going to start off at your aortic valve, which is the second intercostal space right of the sternum, moving to your pulmonic, which is the second intercostal space left of the sternum, down to your Erb's point, which is the third intercostal space left of the sternum, to your tricuspid valve, which is the fourth intercostal space left of the sternum, and then your mitral valve, which is the fifth intercostal space at the midclavicular line. All right, everything sounds good, and now I'm going to listen to your lung sounds, so you could take a deep breath every time I place down my stethoscope. I'm going to start at the clavicle using the ladder technique. So 1 to 2, 2 to 3, 3 to 4, 4 to 5, 5 to 6, 6 to 7, 7 to 8, 8 to 9, 9 to 10. And then I would listen to my patient's lung sounds laterally, and I would also listen to my patient's lung sounds posteriorly. Do you have any issues with cough, chest pain, or shortness of breath? No? Okay, so now I'm gonna move down to the abdomen. I'm going to listen to your abdomen and also palpate your abdomen. So I'm gonna start off at the right lower quadrant, working in a clockwise manner. If I hear a sound, I can move on to the next quadrant. So it's the right lower quadrant, moving up to the right upper quadrant, to the left upper quadrant, down to the left lower quadrant. Great, and now I'm going to palpate, moving in a clockwise manner again, starting at the right lower quadrant, using a dipping motion up to the right upper quadrant, to the left upper quadrant, and then to the left lower quadrant. All right, and then I'm going to check my patient's genitalia. I'm looking for any lesions, discharge, all right, or skin breakdown. And do you have any issues with abdominal cramping, nausea, vomiting, diarrhea? Oh, I'm sorry, not vomiting, diarrhea, constipation, and or urinary issues? No? All right, so now I'm gonna go back up and I'm gonna check your skin at the top portion of your body. I'm checking anteriorly and posteriorly, looking for any skin breakdown, lacerations, abrasions, or bruising. Everything looks good. And then I'm going to just pinch the skin underneath your clavicle just to check if you're hydrated. Right, and your skin went down right away, showing that you are hydrated. And then I'm going to check your radial pulses bilaterally. So I am looking for the rate, rhythm, and force. All right, so 80 beats per minute, normal pulse, no arrhythmias, +2. And then I'm going to check your capillary refill for your perfusion on all 10 of your fingers. So I'm going to squeeze. I'm going to squeeze on every single fingernail. All right, and your capillary refill is less than 2 seconds, which is great. Now I'm going to move down to the lower portion of your body. I'm going to check the skin anteriorly and posteriorly for any abrasions, lacerations, bruising, or skin breakdown. I'm going to check for any pitting edema. All right, so it looks like you have no edema. And now I'm going to check your posterior tibial pulses. I'm looking for the rate, rhythm, and force. Those are by the ankles. So 80 beats per minute, normal pulse, no arrhythmias, +2. And then I'm going to check your dorsalis pedis pulse as well. And rate, rhythm, and force, 80 beats per minute, no arrhythmias, +2. All right, I'm going to check your capillary refill on your toes as well. So I'm going to check all 10 toes as well. All right, and your capillary refill looks like it's less than 2 seconds, which is great. I'm gonna check your muscle strength. So if you could just push down on my hands like you're stepping on a gas pedal, and then try to push up against my hands. And then same with your upper body. I'm gonna have you squeeze my hands, and then try to push up on my hands, and then pull on my hands. All right, and then we're gonna assess your range of motion. So if you could follow me, it's gonna be supination, pronation, flexion, extension, abduction, adduction, and then circumduction. All right, so it looks like your range of motion is good. And I checked your vital signs. They're all within normal limits, and I'm done with my physical assessment. Is there anything else you need from me right now?